Welcome to Brillians training video. Brillians is the new name for the application previously known as SupraVISTA. Today's topic is medical calculators in Brillians. Most clinicians need medical calculators in the daily practice. Many websites offer the medical calculators. Many cell phone apps include one or more medical calculators. The above tools require 1. Manual data entry, which is time-consuming, and is subject to transcription errors. 2. The user must manually type, or copy, the results of the calculations into the progress note. 3. The user may need to go to the separate websites, or apps for different calculators. The Brillians medical calculators address these issues. As a comprehensive cognitive support system, Brillians includes all the commonly needed medical calculators as described in this presentation. In contrast to the options shown on the previous slide, Brillians calculators do not require manual data entry. This is done automatically. You can copy and paste results in the CPRS progress note with one click. Many calculations are done automatically, and the abnormal results are displayed as alerts, as explained on the later slides. So, how do they work? Brillians shows all the calculators on the medical calculators form. Each calculator is placed on a different tab page on this form. Each calculator knows what data it needs, and how to get that data. Therefore, the calculators do not require manual data entry. Each calculator displays the date of the clinical data it is using for the calculations. The clinician can change this data and recalculate the values. For example, the clinician can check what the BMI will be if the patient lost 20 pounds. Here is a word of caution. Our programmers have made every effort to ensure the accuracy of the calculations. Different medical calculators may use variations of a given formula. Therefore, different calculators may produce slightly different results. If the result of a calculation does not make sense, the clinician should double-check the result, and cross-check it with another, independent method. If you find any errors, please stop using the calculator, and inform us as soon as possible. Our contact information is shown on the last slide of this presentation. So, which calculators are included in Brillians? As of January 2019, Brillians includes the following 10 calculators. 1. AA gradient, 2. Anion, and Bi-Carb gaps, and Serum osmolality, 3. BMI, lean body weight, basal metabolic rate, and body surface area, 4. Body weight statistics, 5. Cardiac event risk, based on the ATP-III formula, 6. Estimated average glucose level, calculated using the A1C value, 7. Fibrosis score, for estimation of hepatic cirrhosis, 8. GFR, using the Cockcroft-Gault and MDRD methods, 9. Morphine equivalent daily dose, 10. PSA Velocity. To open the medical calculators form, use either one of the two methods shown on this slide. 1. Click on the Calculators button on the bottom panel. Most users use this method. 2. On the main Forms menu, click on Clinical Tools, then click on Medical Calculators. The Medical Calculators form opens in a separate window, as shown on the following slides. This slide shows the medical calculators form. The user is on the AA gradient tab. The left pane shows the clinical data. On the right pane, the user can click on the Calculate Using Patient Data button. This automatically loads the clinical data for this calculator in the left pane, and displays the results. The user can change the entries in the left pane, and click on the Calculate Using User Entered Data button in the right pane. The results of the calculations, and the button for the copy and paste options, are shown in the right pane. The bottom panel shows the date of the lab data used for calculations. This slide shows the anion gap, Bi-Carb gap, and Serum osmolality calculator. On the right pane, the user can click on the Calculate Using Patient Data button. This automatically loads the clinical data for this calculator in the left pane, and displays the results. The user can change the entries in the left pane, and click on the Calculate Using User Entered Data button in the right pane. For all the calculators, the results of the calculations, and the button for the copy and paste options, are shown in the right pane. The bottom panel shows the date of the lab data used for calculations. This calculator computes the BMI, basal metabolic rate, lean body weight, and body surface area. As true for all the calculators, the Calculate Using Patient Data button loads the clinical data from the medical record and calculates the results. The Calculate Using User Entered Data button uses the manually entered clinical data in the left pane. The Copy and Paste button in the right pane works exactly the same for all calculators. This calculator shows body weight statistics, including the percent change from the selected baseline. The default for this calculator is to use all available body weight values in the medical record, with a maximum of about 60 latest values. As true for all the calculators, the Calculate Using Patient Data button loads the clinical data from the medical record and calculates the results. The detailed weight-related statistics are shown in the right pane. Here is an important tip from Grandma. Remember two words, unintentional and unexplained. If the patient has the unintentional and unexplained weight loss of more than 7%, consider possible hidden malignancy in your differential diagnosis. This is also true for recurrence of malignancy, for example, breast cancer. This calculator computes the pre-event probability of a cardiac event in next 10 years, based on the ATP-III based formula. As true for all the calculators, the Calculate Using Patient Data button in the right pane loads the clinical data from the medical record and calculates the results. The results are shown in the right pane. Here is an important tip from Grandma. There are many cardiac risk calculators out there, which show different risk levels for the same patient. A prudent clinician does not get hung up on the numbers. She uses this information to motivate the patient for aggressive cardiovascular risk reduction measures. This calculator calculates the average glucose level from the A1C value. As true for all the calculators, the Calculate Using Patient Data button in the right pane loads the clinical data from the medical record and calculates the results. The result is shown in the right pane. Here is an important tip from Grandma. Your A1C is 9, it should be about 7. What does this mean to most patients? Probably not a whole lot. But, if you were to say, your blood sugar level is averaging about 200. It should be about 120. Everyone understands that. A prudent provider communicates in a way that makes sense to the patient. This calculator computes the Fibrosis-4 score. The Fibrosis-4 score is a calculated value to estimate the extent of cirrhosis of liver in hepatitis C, NASH, and NAFLD patients. The elevated Fibrosis-4 score correlates with the degree of hepatic fibrosis. Please see remarks in the left pane of this tab page. This calculator computes the estimated glomerular filtration rate. This calculator uses two different formulas for eGFR calculations. It displays results of both these calculations in the right pane, as shown on this slide. The Cockcroft-Gault equation estimates the creatinine clearance, and may be affected by patient's body weight and BMI. The acronym MDRD stands for Modification of Diet in Renal Disease. Neither calculator should be used for estimating GFR in acute renal failure. However, They are useful for estimating GFR and stable chronic kidney disease. Please see remarks in the left pane of this tab page. This calculator computes the morphine equivalent daily dose for patients who are on one or more opioid medications. The calculator automatically reads the active opioid medications names and their dosage from the patient's medication list. Please see remarks in the right pane regarding appropriate use of this calculator, as well as which medications are taken into account. Please see remarks in the left pane regarding information sources used in creating this calculator. This calculator computes the PSA velocity. The PSA velocity is the change in the value of PSA test over 1 year. The PSA velocity is expressed as units of change per year. The calculator automatically reads the PSA values from the patient's laboratory results. It calculates the change in units per year between the previous PSA value and the current value. Please see the data in the left pane. Many urologists believe that, for early diagnosis of prostate cancer, the rate of change in PSA is just as important, or more important, than the absolute value of the PSA test. Grandma says, because the PSA value may fluctuate over time, the calculator reports the highest PSA velocity among the 3 latest values. The PSA naturally rises with age, and the PSA velocity increases with age. Please review literature on this topic. Broadly speaking, the PSA velocity of greater than 0.75 is considered significant. Brillians automatically calculates certain values, and displays them as alerts, if the values are above the threshold. The following values are automatically calculated, and displayed as alerts, if they are above the threshold. 1. Body weight change. 2. Cardiac event risk. 3. Estimated average glucose. 4. Fibrosis 4 score. 5. Morphine equivalent daily dose. 6. PSA velocity. Thank you for taking time to review this presentation. We have many informative presentations on YouTube. Please search YouTube for Brillians Training, or SupraVISTA Medical DSS. If you have any questions, please contact us at help.supravista@gmail.com.